As we attempt these Zoom lectures, the purpose again is to try to introduce to the general public that the biochemistry of life is conducted on the molecules that are in the food we eat. And it's amazing the program that is in the chromosomes, the 46 chromosomes that are in 23 pairs, 23 from the mother's genetic background, 23 from the paternal background, and that in this code, which is much like a cell is a ultra micro factory, and depending on the gene activated, the DNA takes amino acids, fatty acids, carbohydrate, monosaccharides, elements and vitamins and plant phytonutrients, hooks them together to make bioactive compounds. And none of these ingredients have the property of life, but with cellular synthesis, life appears in the biochemistry and the physiology of them. And I'm trying to get across that this research found out that the active ingredient from the aloe supports normal cellular synthesis like a few compounds have ever done before, and that it doesn't matter what type of deviation you have from normal, that by adding the aloe acemannan, which is the active ingredient from the aloe leaf gel, that the metabolism and the cellular synthesis is improved. And that's part of the incredible program that it's in the genes to be able to take lifeless molecules and behold, molecules that have the property of life occur. This is many times more powerful than the code that's in your cell phone, your slate, or your desktop computer. And I sit here in Dallas. There are research companies over in Dallas that are working on research of what kind of computers will we have 5, 10, 15 years from now. And I've had them come and sit with me for as much as a half a day, wanting to know how cells and DNA do this, because at a temperature of 98.6 degrees, which is quite low, and with very minor energy input requirement, our cells were able to do things as with the DNA being essentially a microcomputer controlling the little cellular factory, that if they could do this in cell phones and computers, what is done naturally, it would be an incredible leap in the ability to compute and store information, because under the microscope, if you can, which you require just to even see a cell in the nucleus or the chromosome, which you can't see, you can see where they are. It takes an electron microscope to even see them, is more information than any storage device that exists, like a thumb drive. That a thumb drive, which you can hold in your hand, can't compete or come anything near to the amount of information that's stored in chromosomes. So it's this technology that's in the cell with the controlled by the DNA is an incredible thing. And I'm trying to get across that it supports engineering and design of life when you have optimal nutrition, and that it is non-toxic, it's effective, and it's the most economical approach to health management. So we'll go with this next slides. one of the very vital organs in the human body is the lungs. We're going to focus in this series on primarily pulmonary function. And I will start out with the fact that if you go on Google and for different sayings, you will find they don't know who's did it, and they say it's best to say it's from anonymous, but there's a statement: if you teach me a fact, I'll forget it. If you teach me a principle, I will struggle to know when and how to apply it. But if you tell me a story, I will remember it forever. And so on this pulmonary, this is one of the first areas of health that when we were doing research on the active ingredient, the aloe, that we found out that it was a benefit in pulmonary conditions. And it started with in our hospital, we had various scientific posters on the wall of different conferences that I had presented information for Carrington Laboratories in this country and in Europe. And a individual that was up in Oklahoma and being romanced to try to get, when she finished medical school, to come down and get her clinical training at Dallas-Fort Worth Medical Center, she looked at it and said, this might be a benefit to Rosie. And the story behind the story is that Rosie was about 7 years old, and she had terrible asthma. So terrible that she had been in the hospital, ICU, at least twice, with uncontrolled heart rate being too fast, which sometimes they seem to think it's due to the medications that they take for asthma to try to stimulate the bronchial smooth muscles to dilate and allow more oxygen to circulate into the little bronchial sacs to get more oxygen. But it affects the nervous system to the heart, and they actually die of hyper beating of the heart, just fatigue. Anyway, this individual had been in financial straits because of the cost to be in ICU with Rosie, so she went back to Oklahoma and started little Rosie on the active ingredient from the aloe. Well, even though they had all the material to and instruments to manage crisis in asthma attacks, she didn't have another attack. She didn't have to go to the doctor's office, the emergency room, never went into ICU again. And in fact, she's nearly 40 years old, has been through a pregnancy, and is pregnant again. And the doctors were uneasy about it, but she went right through it with no problems. And she no longer has to take the aloe product daily, but through her childhood and teenager years, she did. And the bottom line of the story, it worked so well that Rosie's mother and I got married, and now we've been married over 30 years. And so that's my aloe story in asthma that is truthful as you can get it. Now, I told you about the 8-year-old Rosie, and that these asthma children die of cardiac fatigue, and that she's, after starting on the active ingredient of the aloe, that she hasn't been in the hospital again. And also, there is a condition in adults called obstructive pulmonary disease, or COPD. You see it advertised on television, different drugs. And the found out that from a nurse whose mother was bedfast with chronic pulmonary obstructive disease, that just by taking the aloe acemannan orally, that her PO2 oxygen saturation of 65% in her blood rose to 90%, and she became alert and improved quality of life. So we had no professional research about looking into pulmonary disease, but in medical school, I was under two influences. One is listening to patients, and if you know how to talk to them and know their language and can understand that the patient can tell you what their problems are and what their diagnosis are. Then there were others that said it's a waste of time to talk to patients. They haven't been to medical school. That's the reason they're coming to a doctor. You draw buckets of blood, send it to the laboratory, send them to the x-ray and do scans, and you can find out what's wrong. Then you go talk to the patient. Well, for the 39 years that I've been involved in research that started with what is in the aloe leaf gel, I've been listening to patients. And if there's any special talent that I have, I think it's listening to patients, making cognitive interpretations of what they're telling me, and believing that the patient knows more about what's their problems are than you can find out in any laboratory or x-ray department. And you only use those things to confirm or to follow the problem. Now, asthma is a all too common problem in young and old patients. And it's the cardinal thing is shortness of breath. Some of them tell me it's like taking a wet wash rag, putting over your face and trying to breathe through it. You just can't breathe very well. Also, your chest feels tight or often pain. Asthmatics frequently have wheezing, particularly when they exhale, and it's particularly prominent in children. They have trouble sleeping because of shortness of breath, coughing, and wheezing. And all of this problem with their lungs makes them predilection for viruses and colds and the flu. Now, lung function is a vital thing. Oxygen is essential for the life and the well-being of all the cells and all the organs of the body. And that these episodes can be triggered by going into a cold room, or going outside it's cold, or by dust, by certain foods. But oftentimes asthma is triggered by some seemingly allergic response, whereas chronic obstructive pulmonary disease, most frequent in people that smoke cigarettes, is a constant shortness of breath, chest pain, wheezing, and being susceptible to pulmonary infections, but it's constant. And both of them lead to reduction in oxygen level in the blood, and this causes compromise in multiple organs because all the cells require oxygen. Now, we were talking about the asthma attacks, that they're frequent allergies, and you have to talk to them, find out what it is. And one of the main things is to avoid allergies if possible. There's food and food additives, sometimes the coloring of foods and sometimes the additives for taste. Exercise can trigger asthma attack. Sometimes they have a heartburn, something that they've eaten. It seems to upset their stomach, and out of this, they have an asthma attack, and smoking is almost lethal to some asthmatics. Sinusitis, certain medications. We mentioned the weather, smoke, and especially tobacco. Now, the Center for Disease Control points out that asthma is different in sexes and races and ethnic groups, and they particularly have here what's in the United States, and that children about 6.5% of children have asthma, but adults, it's a little more like 8%. Now, oftentimes, children have asthma by the time they become adults. They quit having asthma, but sometimes it persists. In sex, that the incidence is about 6.5% of children, males, and females. It's a little higher, 8.9%. And you'll find that whites have a lower instance than, say, Afro-Americans, which they're frequently called blacks, though there's quite a variety of so-called blackness, all the shades. And if you'll notice that Hispanics are less than even the Caucasian race in terms of ethnicity to be susceptible to asthma. Now, this is a graph of what we saw before, that Asians are way down at the bottom, and then you have the light blue Hispanic, and we have a black line there for white. Then it's increased in the Hawaiians. It's significantly increased in Afro-Americans, which is a light, moderate green. And then we have American Indian or Alaskan, which is very high, and multiracial mixed individuals. For some reason, it seems that more recessive genes can be expressed when very unrelated groups have a child. And that's why that's so high, is because of the predominance of recessive genes being expressed by multiracial people. This is from the CDC. Now, in 2017, a survey in asthmatics by the Allergic Foundation of America had surveyed over 800 adults with asthma. That 84% of them said it limited their everyday task, and that 79% of them said asthma negatively affected their physical health. So they don't feel good, there are limitations, and it's something that affects them even every day. Now, asthma leads to deaths. In the year 2022, they did a survey, and they found out in 2020 that 4,145 people died of asthma. Now, it's felt that nearly all these deaths were avoidable with the right treatment and care. And in the year 2020, the deaths from asthma had risen for the first time, and the reason was the COVID virus 19 pandemic, that you add asthma plus this viral effect that has a propensity to affect the lungs. It increases the death rate like never before seen. And that's just one of the problems of being an asthmatic, is you want to avoid particularly viral infections. Now, chronic obstructive pulmonary disease, as I said, is the highest in smokers, and particularly female smokers. But this is the death rate per 100,000 population in the United States. And you'll notice that the highest level is in the dark blue, and the lowest level is in Utah and Washington State, in California, and in New York. And I don't know why it is. I don't know whether the consumption of cigarettes are the chemical plants that release chemicals in the air influence this, but it varies very greatly, as you can see from the, it's about several times the incidence from the highest levels to the lowest levels across the country. So it varies with the geography. And I don't know what it is, and I don't think anyone knows why it varies so much. And it's also high in Hawaii, and of course, it's the highest in Kentucky. Now, this is chronic pulmonary disease in men and women and overall. And the blue is the average of the different years of age-adjusted prevalence of percentage-wise. About 6% have chronic obstructive pulmonary disease, whereas women, as I told you before, is higher. And particularly if women smoke, it is even higher than this compared to men, that they just don't get. And it's one of the things that's thought is to be the habit that that if men have a mucus obstruction in their lungs, they just cough it up and spit. Whereas women tend to, this is not woman or feminine like, they just go and just don't just spit out the thick mucus down in the lungs and cough like men do, which clean out the thick mucus, which is a medium for bacteria and viruses to grow in. Now, well, these are the age-adjusted death rates per 100,000, and you can see that that men die from obstructive lung disease more than women do, and the blue is the average for regardless of sex. But the death rate for women with obstructive lung disease is lower than men, though the incidence is higher in men. And just why this is, I don't know. Now, in Proceedings, which was an announcement journal produced by the Fisher Institute, which I founded with my wife in the early 1990s, there is an issue that particularly focuses on asthma, and it was a study that was done at Loma Linda University because one of the professors, a female pediatrician, had a husband that was a asthma cripple from childhood, and lo and behold, even when he went into adulthood, he still had asthma attacks. And so she gathered 32 mild to severe asthma children from 16 to 18 years of age. And of course, if they're over 18, they're not in the pediatric department. 25 of them completed this study, and 7 didn't keep their appointments or do the test as required. And this was a 6-month randomized, open label, prospective control crossover pilot study testing the glyconutrients or the active acemannan from the aloe leaf gel, and added to it were nutrients from plants, which were 13 fruits and vegetables that I think everyone knows that for decades, grandmothers and mothers have said, if you want to be healthy, eat different colors of fruits and vegetables. Well, that's a empiric observation, long held that if you want to be healthy, have a broad choice of from nature of fruits and vegetables. So this was added to the active ingredient from the aloe. And group 1 had 13 in it, and they all continued their conventional medical regimen and had added to it the mixture of the aloe and the nutrients, phytonutrients, and they were on for 3 months, and then they were off. And group 2 was 12, and they had certainly conventional asthma therapy, and they had 3 months of glyconutrients and with medical management. Now, this is the actual data that they gathered from the children. They have them blow into this device that measures the cc's of air that goes in and out of the lungs and the rate at which they can expel it. And what it shows here that by adding the improved nutrition, that the ability to exchange without obstruction, the flow of in and out of air in and out of the lungs was improved. And this is taking that data and putting it into a chart. And the group 1, you can see how they improved. And group 2, you can see how they markedly improved from their baseline studies that were in the previous graph. And this is the percent of change, and it was up to close to 15% in group 2, whereas it averaged about 10% thereabout in group 1. Now, this is group 1 had some dramatic responses to flow cytometry and symptoms. And exercise improvement was the most significant thing that the patients reported. That the second group, as you saw there, that improved, had a dramatic reduction in their symptoms and medication need, and their increase in exercise tolerance was their most marked benefit. There was no intolerance to the supplements and no adverse symptoms, which is very important because that's so common with any type of drug that you take for anything is toxicity. Okay, the final opinion of this study at the medical school at Loma Linda was that it's because asthma attacks are episodic, that it's difficult to really evaluate them. But 70% of the patients reported daily logs of reduced coughing, wheezing, and with increased exercise tolerance. And this is important in young people that are active. There were no reports of adverse side effects, and the medication relieved bronchial spasm, and whereas medications cause cytotoxic effects like increased heart rate, and that can lead to death. There was none of this in the improved nutrition. It was unfortunate that it was not a double-blind placebo-controlled study, which the Institutional Review Board was hesitant to approve this study in children because it wasn't a medication, and that's the reason they discontinued the children to take their medications if they needed them. But those that were on the aloe didn't need them as much, and they recommended that they should have larger double-blind placebo-controlled investigations to follow up that it was warranted that there was enough benefit. Well, that is our end of our pulmonary studies that developed out of the original story that I told you, that Rosie got such an incredible benefit that had nearly died in ICU because her heart rate got to over 200 and they couldn't bring it down. Well, she never had any more effects like this. And this is very encouraging in terms of that improved nutrition supports engineering and design of life, and it is very important in one of the organs that are so essential for life, the lungs, and the exchange of oxygen that hemoglobin picks up and carries in the blood to all the cells.